So I first found out about certified nurse midwives by accident. I actually had a doctor who I loved and I had been seeing for many years, had already established care, and my intention was when I got pregnant that she would actually attend that delivery. As it turned out, when I contacted the facility to let them know I was pregnant, and I was a very anxious first-time mom, as pretty much every first-time mom is, I contacted them and they told me that the doctor did not actually see their patients until you had made it through the first trimester. And I was concerned by that because I wanted somebody now to help me and to guide me through, that first trimester. Am I doing things right? Am I on the right prenatals? What can I not eat, etc. So at that time they said, well, our nurse midwives will see you. Would you be willing to see them? And I said, sure. So I set an appointment with a nurse midwife, and that was honestly the first time I had heard about a nurse midwife before. As far as the care, honestly, it was a lot of things. My intention was to go to the nurse midwife for a little while and then switch back to my doctor and have her deliver, because I had been with her for many, many years. But what I liked about the nurse midwife was the way that she treated me as a patient. She was extremely patient with me. I was that person who would come in with a list of questions and ask her to, in detail, go through absolutely everything. And she was so patient with me. She would sit down the entire time, look me in the eye, and talk to me. I never felt like I was chasing after her as she was walking out the door, like screaming questions at her, like, please don't leave yet, I still have these. So I think that was what initially made me think, well, maybe I don't want to switch back. Then throughout my pregnancy, I started doing more research into doing a non-medicated birth, and I discovered that for me, I felt like that was the option that I was most interested in. I also knew I wanted to breastfeed. And as I began establishing care with her and talking to her about those being a priority for me, I liked the fact that it felt very normal to her, that she was willing to provide lots of different options for me, alternatives. She would open dialogue with me about, okay, well, do you want to do this then? Do you want to do that? I would come in with these very basic pieces of, this is what natural childbirth looks like to me, so I want to do this. And she'd say, okay, well, how about this? Have you thought about this? And it just became a very nice collaboration between her and I, where everything felt very normal and comfortable. And so after a period of time with my nurse midwife, I ultimately decided that I didn't want to switch back to my doctor, that I really liked just the relationship that I had established with her, and ultimately I never went back. Typically when I talk to people about nurse midwives in general and providing care, what I tend to first of all explain to them is you don't have to go natural. You don't have to go unmedicated. I think some people have this notion that if you go to a nurse midwife, that has to be how you do it. So that's the first thing I always try to dispel. But the other is just in general, I like the way that birth is treated as normal. And it's very much defined by you as the mother and what's normal and what you want for your child. I do feel like nurse midwives do allow you to lead your own birth and have more power and control over your body, your child's body, your destiny in birth in general. So that's what I like the most about the midwifery model of care.